Hi everybody, and today I have a very important video for my patients and anybody else who's watching online, absolutely, who might be having surgery. Please feel free to take advantage of this. But for my patients specifically, I want you to know that this is a pre-op preparation video. It will help you prepare for your upcoming surgery, and it is really critical that you follow all these details because it will make it a smooth process for you to go through your surgery and will reduce the risk of any complications as well. I have divided it into 4 parts. So it's going to be basically 1, 2, 3, 4. The first part is when you are about 1 to 3 months away from surgery. So you have plenty of time. What do you do at that stage? Second is 1 week before surgery. What do you do? Third is the day before surgery, just 1 day before surgery, what do you do? And lastly, what do you do on the morning of surgery when you're leaving to have your surgery done? And you can watch them in that order and see them as many times as you want, so this is where you are completely comfortable. Let's get started. The detail is so much that I couldn't memorize, so I have to use my cheat sheet to narrate it to you. Please watch this video at least 2 or 3 times because there's a lot of information. So let's start with first. What do you do when it's like a 1 to 3 months away from your surgery? Start a healthy routine of proper nutrition, regular exercise, sleep, and meditation. This will, even if you don't do meditation, you can learn it. You can do an app. The apps online are like Calm and Headspace. They're fantastic. Use them. This will allow the body and immune system to get stronger. Also look into arranging a ride, because if you plan early, you'll have a ride to surgery and back home, and that's important. And arrange for a chaperone for the day of surgery. Somebody who's going to bring you, take you home, be with you at night to help you out. If you're coming from far, because I do get patients from out of state and out of country as well, especially for those. If you're coming from far, make travel plans now instead of waiting so you don't have to scramble. Please stop smoking and do not use any e-cigarettes or vaping devices or any recreational drugs. So these are the things you do at 1 to 3 months before that. Let's get a little bit more detailed. Nutrition, what do? Eat organic foods, hydrate with water a lot. Water, not juices, not soda, water. Avoid caffeine. If you can't, I understand, just reduce it. Reduce the amount and avoid alcohol, please. That's very important. Increase vegetable intake, ideally if organic, and avoid any processed foods. If you're willing to learn more about this and say, wow, I would like to learn more, what can I do? I personally learned from this book. Is titled Food, What the Heck Should I Eat? And that's by Dr. Mark Hyman's, and spelled Hyman. Excellent book, I really liked it. So go ahead, read it, take notes and follow it, you'll see a change. Supplements, very critical. At this point, you can start taking vitamin C and vitamin D and a multivitamin. If you take other vitamins, that's fine, keep taking them. Vitamin C, I would say 2 grams a day. Vitamin D, 1000 IUs a day, and 1 multivitamin pill. Next, exercise. Exercise 30 minutes of cardio every day by either walking or running. That'll be great. If you can do 30, at least do 15 minutes every day. That's definitely going to help. Sleep. On average, you should get 8 hours of sleep. Practice proper sleep hygiene. Avoid cell phones in your room if you can. Absolutely no TV, no other distractions. And keep it quiet in your room. If you have trouble falling asleep, then try either the meditation app with the sleep function. They have great things that help you sleep. Or buy one of those baby sound machines to kind of dull the noise so you can fall asleep. Do not consume caffeine after 2 p.m. That's the cutoff. After 2 p.m., no more caffeine. No espresso shots after having a dessert or having just like something just for the fun of it. No, not at all. Even if you're out, no. Make sure your bed and pillow is comfortable. Critical. If you need cell phone for an alarm, fine, keep it there, but then turn it to airplane mode. Next, meditation. Meditation strengthens the mind, improves your pain tolerance, and calms your anxiety. All the things that you need for your surgery. If you're not familiar with meditation, then just like I mentioned earlier, download the apps Calm. Calm is like being calm, CALM. And the other one is called Headspace, like Headspace. And they both have basic versions which are excellent. Start using those. So these are the things for the 1 to 3 month period before surgery. You have plenty of time, so you start changing your lifestyle a little bit. Now you come to like, okay, so 1 week away from surgery. So 1 week before surgery, what do? Please review and sign your consent form. We always send it by DocuSign, comes through secure email. You download it, print it, whatever you want to do, read it multiple times, review it, and then sign it and send it back to us. Make a list of any questions that come to you after reading. Call us or email us. At this point, do a medicine and supplement check. Anything that will increase the risk of bleeding should be avoided from now till healing is complete after surgery. Usual culprits that make you bleed are pain pills like aspirin, Motrin. They come with many different names, so just always check. Only Tylenol, which is also called acetaminophen, is safe. So Tylenol is safe, but nothing else. Fish oil and some other supplements can increase bruising as well. You can always research your supplement or medicine on internet to see if it increases the risk of bleeding. If it does, then you know the answer to stop it. Get all your surgery-related prescriptions filled. Buy all supplies for after-surgery care, such as hydrogen peroxide, Q-tips, cotton balls, Band-Aids. If you have been asked to get a medical clearance by our office, it should be done by now. Arrange for a trusted adult to be with you for the first 24 hours after surgery. Now we move on to the third stage where you've done all this. Now it's like surgery is the next day. That's only 1 day before surgery. Today, you make a bag of all things that you need to bring with you tomorrow. So everything is packed. You don't have to look in the morning at all. Everything is in that one bag. This is my surgery bag. Everything is in there. All the pills, everything, double check it. Leave it there, so this way you have no doubt that you're going to bring everything. Really critical. Especially for people, you know, who are having surgery, let's say a procedure in the office, and you have medications that you need to be given or something, make sure everything is in there, please. So have the bag ready. It should include all your prescription medications given by our office and also the ones given by other doctors, especially like blood pressure medicine. If you forget to bring it, forget to take it for some reason, during surgery the blood pressure can go up. So please bring all those in, please, everything. If you need sunglasses or scarf after surgery just to cover up, like especially with my facelift patients, you know, you want to put dark sunglasses and scarf so that nobody can see when you leave, please put that in the bag as well. Any paperwork or any payments that you need to bring in with you, make sure that's already placed in. Don't wait till tomorrow morning. You're going to be anxious and you're going to forget. And make sure to sleep well. If you feel like you can't sleep or you're afraid of it, you can take a Benadryl if you want. It works. Absolutely you can. But definitely make sure you get good sleep. Try not to be anxious. I'll take care of you. Remove nail polish from at least, or any fake nails from at least like one finger, because when we put that oxygen monitor, if there's a fake nail or nail polish, it doesn't register very well. So just one nail, please. That will be helpful. Try to do it on the left hand. That would be great. Any of these on the left hand. And I think that's it. Once you've done these few things and you have prepared your bag, you're good for tomorrow. Now, the day of surgery. Let's get started. So that's the last thing. The day of surgery, if you're having surgery at an outpatient surgery center or at the hospital, please do not eat or drink anything after midnight. In the morning, you can take your daily pills, which are essentials, such as blood pressure pills, with a small sip of water, not a gulp, small sip of water. If you're having surgery at our office, then you can eat a light breakfast. Light. Avoid caffeine, please. That can increase your blood pressure and make things a little harder. Right after surgery, you can have caffeine, no problem. Do not take any pre-workout supplements, because a lot of people think that, oh, I can take a pre-workout supplement, I'm not working out today, well, that's going to help me, and then the blood pressure shoots up and we have to cancel your surgery. So don't take any of those unusual supplements in the morning, please, especially the workout related supplements. absolutely no exercise in the morning of surgery. If your surgery is a little, let's say like 11 a.m., like, oh, maybe I can go to the gym, let me just get an hour of exercise. No, no, no. You are going to be high blood pressure, heart rate, you're going to bleed a lot more. Please don't do that. Save it. Wear comfortable clothes. No t-shirts, only shirts that kind of like button down, so we can just gently open the button and open it. So if you have to place the leaves or something, it becomes very easy. Bring and wear clothes that you don't care if they get soiled with betadine or something like that. Don't bring any expensive clothes. Absolutely, no jewelry. So make sure all the jewelry is left at home. Don't bring anything. Women think sometimes that the earrings are part of their body. They're not. Make sure you take them off. Any piercings anywhere, take them off, put them away. As soon as you get back home, put them back in. I promise you the holes are not going to close by the evening. So do that. Lastly, check the bag again to make sure that you have your prescriptions, sunglasses, hats, any payments, any paperwork, and your phone as well. There you go. And no makeup, please. And when I say makeup, even eye makeup, some people don't forget to take off the eye makeup. So please make sure that no makeup, including the eye. No lipstick, please. No lipstick, because if you're working in this area, we have to clean it, becomes a problem. So no makeup means zero makeup anywhere on the face or neck. Thank you. I really appreciate that. And then I have the bag is ready. Now please leave early on the day of surgery, because a delay on the road can translate into us canceling your surgery, because if we have another surgery after you, we can't unfortunately bump them or cancel their surgery or move them. We can't. And the only choice we will have is to cancel your surgery. We don't like doing it. So please leave early. It's better to be early. We have plenty of room in the office or in the surgery center where you can just chill, relax. But at least this way you're done and you don't have to rush on the road. I don't want you to rush on the road. Just leave early. And I think that's it. So what I would suggest is that please watch the first section again when you're like 1 to 3 months before surgery. Then watch the second section at 1 week before surgery. The third one again at the day before surgery. And lastly, the morning of surgery, if you say like, oh my God, I forgot what, quickly bring it up. Take a look, check it, check. Maybe even make a checklist. Check, ready to go, and go. And with this, I think it's going to make life easy for both you and me. I look forward to giving you the best care that I can. Have a great day.